One of the things that I'm struck by in seeing hTEE starting to be utilized by these different types of physicians in different areas is the extraordinary consistency in the level of impact that these physicians are seeing. Patients who've undergone open heart surgery are at risk for particular problems that will develop after open heart surgery in the ICU, where we very much need to have direct visualization information to solve those particular problems. So it's pretty well known that TE provides an extraordinary advantage in the post-op cardiac surgical patient, but when that operation is finished, that large conventional probe has to come out, and then the patient is sent out to the ICU, and the surgeon and the intensivist for this cardiac surgical patient have now lost the insight that they had in the cardiac operating room. So having the ability to directly visualize a patient's cardiac function following open heart surgery in the CTICU can help physicians to appropriately hemodynamically manage, and in some cases avoid a reoperation. And avoiding a reoperation is hugely impactful for the patient from a morbidity and mortality perspective, and is also very impactful for the hospital from a cost perspective. While intensivists are doing a fantastic job in taking care of their patients, a lot of times what you don't see is the struggle factor. And so they're very often struggling to integrate, many types of complicated and difficult information and have a very high level of uncertainty. And what TE brings to that situation is a very high degree of certainty with direct visualization information, so they know exactly what they're looking at and what's the right path for them to take, and therefore they're finding that it decreases the time to stabilize patients and get to the right place. We know that we should be looking at this type of information with TE, but because we haven't been able to apply it, wouldn't it be terrific if there were a way to utilize TE type technology for solving our problem in the ICU? And so when we come in and say, here it is, very often the response is, that's fantastic, we've been waiting for you.